Girbeagly!
Hey there guys and gals, it's Girbeagly with another episode of Gaming with Girbeagly, and I'm once again playing another one of the Surgery Squad games over on surgerysquad.com. Now this one is a wisdom tooth extraction, so for those of you guys who have like weird, fears of the dentist or anything dealing with the mouth or teeth, probably don't watch this one. It's probably going to get kind of funky. I remember back when I was younger, I got my wisdom teeth taken out, and it really freaking hurt the next day. I remember that much at least. I did get on some pretty sweet painkillers.
Welcome to Surgery Squad's
Hey,
virtual
Dr. Jeff.
wisdom tooth extraction. I'm Dr.
Oh
Jeff.
boy, Dr. Jeff, you and your craziness, erupted wisdom tooth, whatever the hell that means.
A wisdom tooth extraction
is that when it
is a
erupts
surgical
through the gum?
procedure in
I
which
think
an
that's what it
oral
meant.
surgeon or dentist removes one or more of your third molars,
Okay.
commonly known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort,
I had that.
periodontal disease, or
I
an
don't know what
increased
that is.
risk of damage to the adjacent teeth.
I think I had that too.
Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems.
May have been something that factored in the rest of those
Our patient today
there,
is
Dr.
having their
Jeff.
lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32.
Tooth 32? Well, none of us
Before
are
we
dental
begin,
professionals,
let's
so
get
we don't
some
have to worry
X-rays
about
taken
that
of our
number.
patient's teeth.
Hey, didn't we
X-rays
just give
or
that girl
radiographs
Botox
are
the other day?
essential, low-cost diagnostic tools
Man,
used
she has
to
a lot
examine
of
the tooth's
things
roots,
done to her.
check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First,
Awesome.
insert a positioner into the patient's
Her mouth. That was amazing. All right. X-ray positioner. Let's use that thingy.
Next,
Ugh, made a
position the
weird
X-ray
noise.
cylinder where indicated.
Oh, okay, I'm doing this. Zapper in the head.
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to.
We have a radiation
and take the
barrier, but
picture.
the patient just gets
Don't
to
worry,
get blasted
a
in the
lead
face with
apron will
radiation.
protect our patient from any unnecessary radiation
Right,
exposure.
that lead apron. That's going to do a ton when
I
we
couldn't
shoot
have done
her right
it
in
better
the mouth.
myself. I'll have my assistant finish up the rest of the
mouth.
X-rays, and then we'll view the resulting images.
Oh boy, it's going to be so fun. Oh,
Well,
a
everything
horror
appears
game now?
to be normal with
Dr.
the
Jeff,
wisdom
you need to
tooth's
invest in
roots.
better light
And now
bulbs,
that
man.
all of the X-rays
That
have
was
been
some
completed,
cheap-ass lighting
we can
there.
extract our patient's wisdom tooth.
Flickering and shit. What are you
The
doing?
two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth.
Ah, okay.
Patients
Yeah, I
that
must have had an
two or more
impacted wisdom
teeth
tooth then,
extracted
because mine was
or
like inside
have
the gum.
impacted wisdom teeth may choose to receive a general anesthetic.
Got it.
When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction.
Okay.
Our patient today
This isn't
is only
a
having
surgical
one
extraction?
erupted wisdom tooth removed and has elected to go with a local anesthetic.
Okay. Well,
To
good
begin,
for them. They're brave.
You'll need to apply a topical
Yeah, 'cause I got
numbing gel to
knocked
the
out from my
anesthetic
surgery.
injection site. This
It
will
was-
help decrease any pain the
Ah,
needle may cause.
God, what's up with all the white bars? That was weird. All right, so yeah, these games, like I said before in one of the previous ones, the coding. Oh God, all that white everywhere, all that white in her mouth. Oh God. All right, click where indicated to apply the topical anesthetic. Oh really? It's just not. It's not even a.
Next, we can
A
inject
shot?
the local anesthetic.
Oh, now we
the
inject
patient
it.
may feel a slight
Oh,
pinch
boy.
as the needle is inserted.
Okay.
After that,
go
the
ahead and
area
do-
will become numb for a few hours.
Yay! For a few hours. Holy crap. I mean, I guess the procedure probably takes a little while. So here we go. Oh, wow, that was violent.
And now we'll give our patient a few minutes to become completely numb.
Dentists today use lidocaine, not novocaine. That's interesting. Ooh, this is my jam. 5 whole minutes of this.
Great.
What the hell, Dr. Jeff?
patient's
I was
mouth
gypped.
is numb,
I was promised
and
5
now
minutes.
we can move on to removing the wisdom tooth.
Okay.
First, you'll need to loosen the periodontal ligament and elevate the tooth using
With
a
our
dental elevator.
Fingers? This is that. Oh, with this. Oh. Oh. Okay. Oh, get right up in there. Oh. Oh,
Using the dental
that was
forceps,
weird.
Grip and rotate the tooth in a clockwise rocking motion
Okay,
until
we
it's
can-
loosened and removed.
Definitely do. Oh, with these. Oh, dental forceps. This is just from a tool chest. This is something that you would find in someone's garage or basement to torture people with. Oh, why is it creaking? That's so weird. Oh, God. Oh.
Now clean the area
I don't know if I
using
like
the
that.
surgical suction.
Sure
This
thing.
will allow us to check the area for any bony matter or tooth
I
structure.
guess we've already
that may be
determined
left
that
in the
Dr.
socket.
Jeff is just a torture expert from medieval times, though, so this makes sense. Oh, gross! It's a big hole. Oh, yuck! That's so weird looking. Click where indicated to spray water. Yeah, let's spray that down. Hose it down. Mmm, gooey stuff all up in your... Okay, I'm gonna stop. Oh, God. That looks so weird. So
Everything
weird.
looks great, but we're not done yet. Our patient
That's so
needs
great.
to slowly bite down on some gauze for a few minutes
Okay.
to allow the socket to properly form a clot.
Seems like a professional thing. Seems like a professional method of getting blood out of someone's mouth. Here, bite this gauze.
Since the patient is
You do
clotting
the work.
properly, we can go ahead and place some fresh gauze in their mouth.
Okay. There, you deserve fresh gauze. You did a great job biting those
When
other
getting
ones.
wisdom teeth
Oh, hey, it's
removed,
me.
It's important to remember that everyone recovers at different
I'm taking a
speeds.
nap.
The rate of your recovery depends on a number of factors,
Oh, yeah?
including the complexity of the extraction, your age, and your individual recovery
And how
capacity.
hard the evil doctor
Often,
pulled your tooth
patients
out.
will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday.
Okay.
After the surgery, the oral surgeon or dentist
That's
will
some
provide
sound
some
advice there,
information
kids.
tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the
Okay, I
first
did
24
that.
hours to reduce swelling.
That's pretty common knowledge.
Refraining from physical activity for the first few days.
Physical activity,
Avoiding
like
sodas
running?
and the use of a straw. And gently rinsing your mouth out with warm salt water.
I
to
was
help
not told
relieve
any of
pain
these.
After the first 24 hours.
I kind of just did what I wanted.
It's also suggested that patients do not smoke for at least 24 hours after
Aw,
their
man.
surgery.
How do you get your
Smoking may not
420
only
ml
delay
genus
healing,
then if you
but
can't
it will
smoke?
also reduce the
Can't
blood
smoke
supply.
weed every day.
It could introduce germs and contaminants to
Freaking
the
stupid
surgery
wisdom
area.
tooth extraction.
And that's a wisdom tooth extraction.
Oh,
You
fun.
did great.
Thank
if
you.
you're up to it, why not try another procedure?
No,
on
I'm still not medically
surgerysquad.com.
qualified to do any of these. But anyway, guys, that was a wisdom tooth extraction. Actually, it wasn't quite as bad as I thought it was going to be, but it was still kind of nasty to hear like the tooth like creaking and then getting ripped out of the socket. But anyway, guys, if you enjoyed this episode, please be sure to hit the like button, share the video, and favorite it. Also, be sure to subscribe to me if you guys haven't already. For those of you who have, thank you so much for all of your support. You guys are the best in the world. I love every single one of you, and as always, it was great seeing you. Bye-bye. Wonderful. Oh no, it's all dark. I don't like this. Oh, I don't like it.
大変だったんだから。
Yeah, sure. It was tough. What's going on?